Hi, my name is Jessica Saenz, and I'll be talking about dementia. I'll first discuss what dementia is, along with the causes, the symptoms, the stages, and how to care for a dementia patient. Dementia is a brain infection that the brain will gradually disconnect. The brain is caused to shrink and causes a widespread of impaired functioning. When the brain is shrinking, it means the nerves are under attack, meaning like if a spider web is connected to make a spider web and a string disconnects or gets cut off, it just starts getting gradually smaller and smaller, and that could be used as an example for how a dementia brain keeps getting smaller and smaller, how it deteriorates. Dementia is irreversible, meaning like once you are diagnosed with dementia, it can't go back because right now it's not curable. Dementia grows slowly, or it can go also rapidly, very quickly. History of dementia. The history of dementia began in the early 1900s, and it was about elderlies in the 80s, how they developed the dementia of losing their memory. The most common dementia would be the Alzheimer's, the frontotemporal, and the vascular. I included this picture because it helped me understand what dementia really meant. Dementia is a type of term rather than not a disease. It's a syndrome to all the other the brain disorders, such as the Alzheimer's, how it's the most commonly brain disorder out of the dementia. This other picture I wanted to include because it talks about how this is a normal brain, a healthy brain, and then this is the dementia brain. The dementia brain starts to lose in the frontal lobe, which is around right here, and it starts disconnecting and shrinking smaller and smaller. Next, I will discuss the causes, the symptoms, and the stages. The symptoms would be the memory. You can lose the main symptom of losing the function is the memory in dementia. The next is language. For instance, my papa had dementia, and he knew Spanish and English. Well, dementia, you remember more of the things in the past rather than what's happening in the present right now. So in language, he would stop talking more English, and he would end up just talking Spanish, which we just kept having to keep talking English with him. You can be able to lose your visual. You lose your motor skills, such as being able to get out of your bed on your own, going to the restroom, or even eating at the table using your hand to eat. Also, attention span you can lose as well. Possible causes could be from types of medicines, the vitamins, or emotional problems such as depression. Such as my papa, he was in the war, so it made him depressed of like what happened, what he did, and that could have been a cause of why he had dementia. Or he also had thyroid problems, which that causes a dementia as well, and excessive alcohol use as well. Next, I'll be talking about the stages. You have the early stage, the moderate stage, and the severe stage. The early stage, it's mainly about just forgetting little things or losing or misplacing your belongings in the house or somewhere. And you can also be confused at times because you're forgetting things. And at the beginning, the dementia patient might know what is wrong, and they get frustrated and irritated because they know they're forgetting what they know. You can also lose concentration. For the second stage would be the moderate stage. The moderate stage is increasing the memory loss. You just keep losing more and more because it just gradually keeps growing of the dementia. The next one would be processing conversation, just like how forgetting language. You forget how to conversate with others. You forget how to properly make sentences to help others understand what you're trying to say. The last one would be the severe one. The severe one is losing mobility, such as you're not able to get up out of your bed. Like people have to help you, have to help the dementia patient use their function of the body because their nerve cells keep deteriorating and they're losing how to do the certain functions. The next one would be unable to recognize people. That could be a struggle for the dementia patient along with others because others would get upset because that person would forget who they were. The last one would be the change in personality. The change in personality is very severe because they don't know who they are, along with others they don't know who they are because they're forgetting who they are from the functions. Here I want to demonstrate how this is a healthy brain and this is a dementia brain. The dementia brain is shrinking and the frontal lobe is starting to shrink right here where the blue part's at. And then it starts gradually growing and growing, and the brain just starts getting smaller and smaller, shrinking. Next, I want to show this because how I said about the spider web of the nerve cells disconnecting and shrinking. Well, this is showing a healthy nerve cell, and then this one's showing a dementia cell. This is just like how if there was a spider web and the strings just start coming apart, and it just starts deteriorating and getting smaller and smaller. The final thing I want to discuss is the activities. The activities is very important because it helps the brain function for the dementia patient. Outside activities helps you use your 5 senses, such as your touch, your seeing, your smelling, your tasting, and the sports events could be a possible outside event because it helps the dementia patients be in the outside world and not just stuck inside. Along with walks, that helps their mobility along with just seeing how everything it is outside and not being inside. Animals, such as my papa liked watching birds outside and seeing things just going on out in the nature. It helped him connect in the world, but and inside. For animals, such as he liked looking at fish tanks, and I believe that the fish tanks, it's more of a nature that he could see how they're calm, and so he would be calm. The insides he can color and draw, which that's more in the very beginning of it. You have music. Music is a very important activity to help function of the brain of the dementia because they know more of the past and they know more of the present. We have folding clothes that helps the mobility. Then we have counting money, and then playing catch. That can help the mobility as well. And then with the verbal skills is telling historical stories, such as he would tell stories about the war, which would help his brain keep functioning. And this last picture I want to show is how this is nature and how it's very important for the dementia patients to be a part of outside world rather than just being stuck inside. It shows how the human brain is normal and healthy, and it shows how the leaves are like flying away, such as the brain, how it's just shrinking more and more. He's losing the brain. And then the severe stage, you have all the leaves all flying away, and you have how the brain just keep getting smaller and smaller. Thank you for your time.